Warning. Listening to this show may result in increased levels of inspiration, motivation, and innovation. Side effects can include the immediate urge to take massive action to build a better business and life for yourself and others. You've been warned. Welcome to Influencers Radio with your host, Jack Mize.
And welcome back to another episode of Influencers Radio. You know, they say one of the toughest jobs in the world is being a mom, and you would get no argument from me on that. But my guest today is shining a light on one job that just might be as tough, if not tougher. And that's to be a daughter or daughter-in-law to a senior parent who is unable to care for themselves. The pressure can be tremendous, both emotionally and financially. Can leave a caregiver overwhelmed, exhausted, and with feelings of guilt because they just don't have enough time to care for their loved one or enough money to get help. And my guest today is Therese Johnson. She's a gerontologist and an educator for the California State Legislature and the California Board of Registered Nurses. She's also a writer and a local TV producer and radio show guest host for Senior Moments on 105.5 FM in Sacramento. And she's also the founder of Senior Care of Sacramento, a placement and resource referral agency for centers. Therese is also the author of the recently released Amazon bestseller, Saving Seniors Savings: Best Kept Secrets on How to Pay for Senior Services. Therese, welcome to Influencers Radio.
Hi, Jack. Thank you so much. Such a pleasure to be on iHeart.
Well, I tell you, I'm reading your book, and this is something that a lot of people don't think about, but I guess a lot of people are forced to think about it at some point in their lives. And you've really been around this for quite some time. You've spent the last 20 years working in acute care, long-term care, and as administrator for residential care facilities for the elderly. And I want to get into that. But what I want to start off with that really fascinated me and hit me was talking about the caregivers. It seems that the overwhelming feeling of guilt is really at the core of the emotional toll and health risk that they're facing. Is that what you're seeing?
Yes, absolutely. And I know firsthand because I've been a caregiver myself, not only in a professional capacity, but also in my personal life. My mother-in-law passed away with dementia, who I helped care for. And also my own mother is going on 8 years suffering with dementia now. And in fact, they just recently put her on hospice. And so I'm a mother, a daughter, a daughter-in-law. So I'm like one of those caregivers that's experiencing this. And I mean, 8 years is a long time. And the average time for taking care of someone with dementia is 7, although it can go up to 16 years. But on average, you can plan on about 7 years. And my mom's pretty much right there in that average. She's going on 8 years, and they just put her on hospice. And we have a large family. There's 8 brothers and sisters, but you'd think there'd be plenty of help. But if you're all spread out and they don't all live in the same place, or if you only have 1 or 2 siblings to help care for someone, it's very demanding. And then a lot of my sisters and just like a lot of caregivers and daughters, they're around the age where they're still taking care of their own children. So we call them the sandwich generation. Not only are they still trying to take care of their children, but now they're having to take care of mom and dad, and it leaves very little time to themselves. And so I'm always stressing that it's so important for them to make sure and take care of themselves and get a day off, at least one day off, preferably 2, because then they'll start having health problems because of the stress. It's just too much for anybody, and everyone thinks that, oh, no one can do it better than me. And, or you promised your mom or dad that you'd never put them in a facility. And it's just with dementia, especially, it's just not always feasible. I mean, that's a 24/7 job sometimes, and one person can't do 24/7 and have a life of their own. It's just not healthy. So it's a big problem.
And that's one thing that you bring up. You talk about the sandwich generation. One of the things that has obviously been happening in society is that a lot of people are waiting later in life to have children, and I guess that's what puts them in the sandwich generation, where they're both taking care of their kids, and then find themselves in the position where their parents may need some of that help too. And I guess is that where it's not even subtle. That's got to be overwhelming. And I want to make sure and bring up that we're not neglecting men in this, but there's some, solid statistics out there as to why we're speaking about daughters and daughter-in-laws. Can you talk about that?
Well, yeah, because 95% of caregivers are daughters and daughters-in-laws, but it does, but there are some men that are also sons and daughters, but, usually, most, the older seniors that need help are generally women because they have a longer life expectancy. So there's more women needing care of. The men usually die younger. And generally speaking, there's more female caregivers. So that's why we address them. But I've met lots and lots of amazing men that are also do caregiving, spouses especially, that are so devoted to their wives. It's just, they're incredible. I mean, I know some amazing men and sons that also are excellent caregivers. But I mean, this affects everybody. It's not just the daughters and daughters-in-laws, because it affects their whole family dynamics. It affects the economy. It affects business. When daughters and daughters-in-laws have to leave the workforce or take leaves of absence because they're having to take their loved ones to the doctors or for doctor's appointments, or go take care of mom or dad because they fell or had to have a hip replacement and they're missing work, or if they end up having to cut back and can only work part-time instead of full-time, there's a huge percentage of people in that category. And that's, of course, going to affect the whole family, because that takes away from the income. Most families are two income earners these days. So then the husband is stressed because he's having to, provide more, because the wife is no longer able to provide as much income. And so it affects businesses because their employees are having to call in sick or call off work. And we have maternity leave for young workers, but we don't have any maternity leave for seniors and or for workers to take off to take care of their elderly senior loved ones. So it's an issue that needs to be addressed. It is getting some attention now in our legislatures, but it's very slow going.
Well, I think it's getting attention. I think thanks in large part to folks like you. I mentioned at the top of the show that that those feelings of guilt and that overwhelm and that stress it really starts because people don't feel like they have enough time to care for their loved one, or don't have enough money to get help for them. And that's what you have really opened up the eyes and the options for people, that does not have to be the case with your book, Saving Seniors Savings, Best Kept Secrets on How to Pay for Senior Services. So let's get into that. I think when most people think about caring for their senior loved ones, there's two avenues to go by. There's home care, and then there's care in a facility. So let's start with that. What do you see as being, the decision criteria that people are making with that, and are both options open to people that they may not realize that they have open?
The biggest problem I see is that people don't plan ahead. And by the time I get the call, it's a crisis situation. Mom's in the hospital, or the discharge planners are calling me from the hospital saying so-and-so fell if they have no family, and we need you to come in. They can't go home. They need care, and can you please find them a place? So, or at least temporarily, so that while they rehab if they broke their hip or they were just recently diagnosed with dementia, and now it's like, oh, what do we do now? Are we going to have to move mom in with us or dad? And so, and then people are it just like hits them like a ton of bricks if you don't plan ahead. And and in this day and age with our bureaucracy, unfortunately, it's somewhat dysfunctional. And so, as everyone knows, even for a younger person to go through government policies and procedures and resources that are out there, it takes time. And if you didn't plan ahead and do it in advance, then it can severely affect the families financially, in addition to all the emotional stress you're having at the moment because a crisis happened. So I wrote the book to educate and encourage people to plan ahead, and also I wanted to dispel some myths that people have regarding thinking that there is no resources or help out there. There's a huge myth out there that it's a term called spend down that I just really do not like. And
what does that mean?
Well, people think that you have to spend down your money in order to get Medi-Cal or Medicare, Medicaid help to pay for mainly skilled nursing facilities if someone has to go into skilled nursing, or to get any kind of health care. And that is just not the case.
And I hear that a lot. I hear that a lot from even in my family, people, and it's a contradiction in terms, because they say, "Oh, I can't afford that. I have too much money."
The program is meant to ease the financial burden associated with long-term care. And while some people, they erroneously believe that Medi-Cal to be a form of welfare, and it was actually funded by personal income tax. So while it's administered by the government agencies, money available to Medi-Cal recipients largely comes from the taxes that you and I pay and when we're in the workforce. And so in California, taxpayers contribute to Medi-Cal with their state and federal income tax payments. And I've been working, and one of the most common challenges families deal with is figuring out how they will fund that long-term care expenses. So it doesn't matter if the person who needs the extended care is a young child, an elderly parent. The funding strategy may be a little different, but the outcome is the same. And the older generation is the one that's paid all this money into the Social Security. And so, and this is what they paid it for, to help pay for Medicare, Medicaid, and Medi-Cal. So, but it's so, and depending on your family situation, they may have already faced some confusion regarding this Medicare, Medicaid, or Medi-Cal. In California, we call it Medicare. Nationwide, it's called Medicaid. It's the exact same program. So that confuses people somewhat. And it's not always easy to understand what the program pays for or what the requirements are. I've helped many families who assume they would have to sell their homes just to pay for the care of their loved one. Some people who have very few assets try to obtain Medi-Cal benefits, and they're denied. They might hear from a Medi-Cal caseworker that they have too many assets and they need to spend down. This is bad advice, and it can have serious consequences. And my goal is to help families avoid mistakes that might disqualify their loved ones from receiving benefits that they deserve or spend money needlessly. It's all about knowing the requirements for Medi-Cal and Medicare, and repositioning and having your assets held in the way that they require you to do. And they give you the guidelines. They tell you how to do that. And it's confusing. And that's why we have specialists that do that. I don't even do that. When I had to get benefits for my mother to qualify her to get money to help pay for her, and she was a nurse for 45 years. She had a pension. She had a pretty good income, but the cost of healthcare today just requires that most people, middle-class people, are going to need this kind of help and income support. And that's why it was created. So, but I even paid a specialist that I work with. That's all she does is Medi-Cal and Medicare. And because especially with our healthcare system today, everyone knows, kind of what a disaster is going on with that situation. You have to work with a specialist. And the most average person, if they submit an application, if you don't dot every I and cross every T just right, it's going to be rejected. They just do it automatically. So it saves you a lot of time, energy, money to work with a professional and have them at least review the application before you submit it.
And I think that's where a lot of people That's just an insurmountable obstacle that a lot of people feel they face is they just don't know what to do. There's so much, I guess you would call it bureaucracy, or, like you said, things have to be filled out just right. And when they're doing this at the same time that they're dealing with this emotional crisis of having to deal and be that caregiver, I can see where people panic and just don't take advantage of these. What would you say is the percentage, or do you feel that there's a lot of people out there that could be receiving help, that could be taking advantage of programs that just aren't, and they're suffering unnecessarily because of this?
I do. I think that then they're overwhelmed. They just don't have the time and the resources and the wherewithal to look into it and figure it out because it's too complex. Like I said, I'm a professional and I don't even want to do that, go through the medical process. So that's why it's best to just hire a professional or use an agency like mine, Senior Care of Sacramento. Or I'm a full service geriatric case manager. So, and there's others out there. So if you can find a geriatric case manager, somebody that can create a long-term care plan for you, for your particular situation, that can see exactly what your financial situation is. They can tell you maybe how to deal with your particular assets or what resources are available to you based on your assets, what categories you are allowed to come under. Certain programs allow you to have so many assets in liquid, but then other assets have to be held in a different form. So it's just a matter of knowing those legal requirements and positioning yourself so that you can qualify for some of these other programs that are out there, like the veterans benefit for veterans. I mean, most veterans over 65 think they already got their benefits when they were younger and when they got out of service. They don't even realize that there's an additional benefit if you're over 60 and 65 in addition to what you're already receiving, unless you're already getting the maximum 100% disability. Most veterans are not deemed 100% disabled, and they go through life and have a life and work and do everything else. But once they hit 65 and retire, there's an additional benefit that they can use for their care. And the Veterans Administration does a very poor job of educating and letting people know about this.
Well, that's that's the thing is there seems to be a lot of programs out there, or that appear to be programs out there, and it seems that it's not a question of when you go to pick one about good, better, best when it comes to picking the right government programs. You feel that there are some that are just dysfunctional and should be avoided altogether. Is there a way to determine that?
Well, it's based on my experience, and it depends also where you live. Certain areas, the programs work. Certain areas, they don't have them at all. Certain areas, they're just not funded properly, and they can't function. They don't have the staff. So, but I focus on the main ones that help people the most, and basically that's why we do an assessment. We do physical, financial, overall health assessment to determine, I can determine based on life expectancy, based on their diagnoses, if they have diabetes, dementia, Parkinson's, whatever the case may be, I can figure out a long-term care plan, and any geriatric case manager can do this for that particular individual, and then we can determine based on their assets by doing a financial assessment what programs they qualify for, because I know all the eligibility requirements for the different programs. So then I can set them up and point them in the right direction. These are the programs you qualify for. These are the ones you should go and do, when to do it, what order to apply for them in. They have to be done in a progressive order, some of them, especially for asset protection. And that's the main thing. But you need a professional to guide you through that process, because the average person, it just doesn't have the information, and it's not out there.
Let's talk about the other end of the spectrum, because we've talked about people that, I don't know where I'm going to get the money to do this or how I'm going to do it. But there's another segment out there that people's parents, senior parents, have built a sizable asset, and you talk about asset protection. And it seems that there's also a risk, without doing this correctly, that there's a risk that could be wiped out very easily if it's not gone through the right programs or done the right way. How real is that risk, and how severe is that risk?
First of all, the problem is that a lot of people have this myth thinking that they got to spend down. And the Medi-Cal benefit has been funded through our tax dollars, your tax dollars. It's not welfare. And so you do not need to be in poverty to qualify for Medi-Cal. So I really want to dispel that myth. And so, because then they close their mind to the possibilities of qualifying for Medi-Cal. But as long as you follow all the regulations that allow for the spend down process, that's why it was created. And so the best way to protect assets is to speak with a professional that can teach you how to do that. I do think that there are people, because they think it's welfare, I'm not going to do that. I mean, you paid into it for this program. I mean, do you pay your taxes? Do you take your exceptions every year? It's very important, because if we're having the daughters and daughters-in-laws at 40 to 50 taking off work or going to part-time or leaving work altogether to keep mom at home and take care of her, that's 10 years that she's not paying into her own retirement. So it becomes a vicious cycle. What's going to happen now when mom passes and now she either is she can't get back into the workforce, or if she does, she lost 10 years putting into her 401k. So now she's not going to have the money to pay for her long-term care. It's a vicious cycle. And that's what this entitlement program was designed to do, to avoid that.
Yeah. And well, I think there's also a mentality by some people out there that maybe oversimplify this process. And, you hear stories about, it gets to that point, you just sign over your Social Security benefits and Medicaid, Medicare take care of the rest. It's clearly not that simple. No.
Well, if you're low income and you have no assets to protect, let's face it, the more money you have, the more choices you have. The less money you have, the less choices you have, and the choices may end up being made for you. So if you are low income and you don't have any assets to protect, and your only income is Social Security, basically the choices will generally end up being made for you, and your care, depending on your level of care, you may end up in skilled nursing, and then they do take all of your your Social Security benefits, other than, I think right now they leave you $35 or something like that. So yeah, that's the case for if your only income is Social Security.
And like you said, the more money you have, the more options you have. But I think obviously the more risk that you have. Let's say you do have a parent or someone that you're taking care of that has worked a long time, and they've built up, and they've earned and created that savings for themselves. How would you go about preventing them from losing that savings? Is it something that can you speak for them? What are the mechanics of that? Of if they're not capable of making choices, or when can you step in and help to make those choices?
Well, and they're the people that really need the long-term care planning to preserve their assets for their heirs, and that's what we do. We can determine when is the best time to do that based on the overall assessment and evaluation that we do for them, and when to start certain programs. Because of our bureaucracy, certain programs are taking 3 to 6 months to qualify for. Certain programs are taking 9 months to a year, some more than a year. So you have to do it in a progression. You apply for this program first, then this one, and you get them started. And you need to plan ahead of time, because if you've already been diagnosed, especially if you've been diagnosed with dementia, you have to start the planning in advance, because if you wait till the last minute and you have to apply for this program, and it's a program that takes 9 months to a year to qualify for, how are you going to pay for it in the meantime? I mean, that's when it starts to get very difficult and stressful for people. But the more assets you have, the more you need to do asset protection.
And I guess that's where you step in. You help them navigate through this maze of options and our options / risk, I should say. It's not something people that generally, they don't think about proactively. It seems to be a reactive thing. It's, once something happens. What do you suggest for people that, one, they may be in the situation as of being a caregiver, but also I think that you're really putting a spotlight on this and making people think ahead that, what can I do to avoid putting my potential future caregivers through this experience?
The best way is to create a long-term care plan with a long-term care planning expert, such as myself or a geriatric case manager. The other problem we have is that people put it off because there's myths out there about, especially with our elderly generation, they still remember assisted living and board and care as they have horror stories from when their parents went to one or went to some place for care, and this was back when they were young and the industry was not licensed and regulated as well as it is now by Department of Health and Social Services. And the healthcare industry has really grown up. And I mean, the assisted livings now are like, some of them are like 5-star hotels. They're beautiful, amazing amenities, socialization and activities. They have entertainment come in. They have happy hours on Fridays. They bring entertainment to you and you pick and choose which activities you want to provide. They, have all kinds of events. I mean, hey, I would love to be in a 5-star hotel when I'm 80. I mean, you worked all your life, you saved. The people that did make a lot of money and can afford these places. And there's different income level places too. You may not get as many amenities, but you still can receive excellent care. Our philosophy, and most people want to stay at home as long as possible, and that is understandable. I probably will too. Although I don't know, I kind of like being waited on. I say you saved all. And some people just don't realize that they saved all their life and the time has arrived. They don't realize, the time has arrived. It's time, all that money I've been saving, they've been saving. It's a habit for their whole life. And then they hit 80 and like so many of us, even though our body is 80, we still think like a 30-year-old and we're still doing the same habits of saving. But now, okay, I've saved all this money, but you were saving it for now when you were 80 or 85. I come across this a lot. And it's so cute. I go, well, they go, well, I save this every month. And I go, okay, and what are you saving that for? And they go, for when I get old. And I go, and how old are you? And they go, I'm 87. And I go, do you think you've arrived yet? Is it time to maybe you could spend a little bit of it?
That is, I guess that's nobody wants to face it. It's happened now. So that brings up a good point. What is an ideal, I don't know if it's an ideal age or if it's more of an ideal situation. If someone is, say, 50 and they have, kids that are, 18, 20, 21, that's a pretty good span that you can think that, your kids may be in the middle of their, the meat of their life when you get to that point. What's the ideal time or situation for someone to come to someone like you to say, hey, what should I be doing?
Well, ideally, they've when they were younger in their working years, they met with a financial advisor or their employer has a 401k matching system. And so they've done some retirement planning. Everyone should do that. I recommend when they're young, but then those plans need to be updated regularly throughout your lifetime. And so, and unfortunately, there's a lot of attorneys out there that don't specialize in elder law. I really recommend as you get older that you see an elder law attorney who specializes in estate planning. It's a very specific field, and the laws are changing. And so you need to update all your, everyone should have a power of attorney for finances, a power of attorney for health care. You never know when a car accident can happen or something can take you down. So you want to have somebody who can speak on your behalf. So everyone should have those documents completed. And no matter how old you are, I mean, there was one huge case in the news that everybody heard about quite a bit. And so when something like that happens, if you don't have a power of attorney, you don't want to end up in court and spending, money on attorneys fighting, for your loved one. And so it's a kind of a lifelong journey, but it really, if you don't want to wait until you're, 60 and retiring and then decide, maybe 50 or 55, you're getting close to retirement, say, I guess I better make a plan. So, but most people do, and it's not too late. And actually, in a way, for the type of plan I'm talking about, that's a good age, anywhere between 40 and 55. You should be planning. You've lived a lot of your life almost. If you're 50 years, you've lived, the average life expectancy for our generation right now, the older generation, is 83 to 84 for women and for men, and 93 to 94 for men. So if you're 40 or 50, you're on your way. The majority of, you still have another maybe almost half of your life left if you're in good health. But by then you'll know how rough of a life you've lived, what your health diagnosis, at about 50, your health diagnoses start popping up. And at 60, most people are starting to see, I have a chronic illness. And at that point, we know what to expect down the road based on how you've lived your life and your health diagnoses, the medications you're on. We can get a pretty good idea what level of care you're going to need down the road in 10, 20, 30 years, or maybe sooner. So, at 40, between 40 and 55, depending on how healthy you are, and if you've done planning ahead, if you've, when you were younger, and if you didn't, all the more urgency to do it.
Well, I have to say, your book is not just full of information, but your passion about improving the lives and the quality of life of not just the seniors being cared for, but also the quality of lives for the caregivers themselves. And that's something that I think is unique. And you obviously see a lot of times you see advocacy for the elderly, but you spread that advocacy to not just the elderly, but also their caregivers. So I definitely commend you for that. And it's certainly one of the reasons that I feel that you are an influencer. I know you talked a little bit about this earlier, but what was it that made you decide that, to write this book that led you to say, I'm going to put this out there and get it out to the masses? Because you've been helping people with this, one-on-one for so long. What made you decide that I need to put this down in pages and reach further?
Well, because it's such a huge need and there's just not enough education about it, and people just aren't doing it. I get so many calls in crisis situations, and it's so emotionally painful. When you haven't planned, it's so much harder to deal with, and it's so stressful, and then it causes more and more problems. If people would only plan ahead, it can make your life so much smoother and easier. And it's hard to watch people suffering and going through all that emotional pain when they haven't planned ahead. And with my own experience, it's painful enough I have 8 brothers and sisters, and trying to, satisfy all of them. Everybody has their own idea of how my mom should be cared for. I mean, just in my situation alone, and trying to, keep harmony in the family and try to get everybody on the same page. Even just trying to get my mom to do her power of attorney form was excruciating. And she was a nurse for 45 years, and she knew the importance of it. But it was like, she said, I had to keep asking her for 3 years. I go, Mom, you don't want your kids fighting over what your wishes are. We need to know what your wishes are and who you want to be your voice if you have a stroke and can't speak for yourself. And after 3 years, she finally did it, but then she wasn't talking to me because she was mad at me. She said, well, what is it you want? I go, I just want to know what your wishes are, because I'm the oldest, and I know all my brothers and sisters, everybody, that's too many people to have to deal with. And I had already been through it when my dad passed away, and I didn't want to have to go through it again with my mom. And I was like, please let us know, what your wishes are. And so then a year, she said, well, it was just, she apologized a year later and said, I'm so sorry. She sent all my brothers and sisters a copy of the power of attorney for healthcare and finances except me. And I'm the professional in the family. Yeah. So I'm like, really? I'm like, thanks a lot. And but then a year later, she apologized. She said, I'm so sorry. She said, I just it was like facing my mortality. And it was emotional and difficult for her just to do it. And I think that's probably why people put it off. But they simplified the process. It's pretty simple. The hard part is when someone doesn't have family or have kids. And then who are they going to make that? Then they have to have either a really good friend, or some people, they've outlived all their friends and their family. And if they wait that long, and then who's going to make the decision for them? Then we have to set them up with like private fiduciaries or if they have dementia, sometimes they end up having to get a conservator, and it gets a lot more complicated and then more expensive if you have to go to court to get conservatorship. So the sooner you have your parents' plan so that doesn't happen, once they get dementia, then you can't even do the planning of the paperwork, because then it has to go through a court process. And that, who wants to go through that? You know what I mean?
Yeah. Well, yeah, especially during that time. Well, I have to say, I think you've definitely opened up a lot of options and opened up a lot of eyes around this topic. How can people find out more about Therese Johnson, follow what you're doing, and also get a copy of your book, Saving Senior Savings?
Well, the book is on Amazon, so you can just type in Saving Senior Savings. It became a bestseller right away when I published it, and you can get it in paperback version or Kindle. You can also go to my website, savingsseniorsavings.com, and you can click on right there and buy it. You can, and if anyone needs long-term care planning, you can also call me at 916-877-6904. Or, like I said, the website for the book is savingsseniorsavings.com.
All right. Well, Therese, I got to thank you for coming on and sharing this information and taking the time. It just tremendous information, and you truly are an influencer because you are affecting a lot of people and their families and improving the quality of life. So again, I want to thank you for that as well.
And thank you, Jack. I really appreciate it. I'm doing my best to educate as many people as I can to alleviate suffering and make life easier for people. Things are difficult enough as it is these days in this arena, especially with healthcare. Yeah,
and it's definitely something that sneaks up on people. So I'm glad that there's someone like you out there that can help them in a stressful and emotional time when decisions may be difficult to make. Folks, there you have it. Definitely check out Therese's website, savingsseniorsavings.com. We'll have a link to that on the show post, as well as pick up a copy of her book. Again, you grab it on Amazon and Kindle or paperback. It is Saving Seniors Savings, Best Kept Secrets on How to Pay for Senior Services. Until next time on Influencers Radio, remember, you are the only real game changer.
You've been listening to Influencers Radio. To get all past shows and updates on future shows, visit influencersradio.com today or follow us on Facebook at facebook.com/influencersradio.